Hello, my name is Ramin Dhaliwal, and today I will be presenting on alcohol use disorder and evidence-based assessment. Throughout this presentation, I will discuss the key DSM-5 tier criteria, assessment tools, and the importance of cultural considerations in addiction psychology. This topic is especially personal to me just because it has such an impact on the Indian community and personally in my own life with my dad's addiction. So I thought this would be a really relevant topic to discuss. So alcohol use disorder, or AUD, is a long-term condition where a person struggles to stop drinking alcohol, even though when it causes problems in their lives, whether it's at work, relationships, with family members, friends, or even it has an impact on their health, they continue to drink. According to the DSM-5 TR symptoms, which includes strong cravings for alcohol, withdrawal when not drinking, but we'll go ahead and discuss this a little bit more in details in the next slide. But why is AUD significant in addiction psychology? Alcohol use and AUD is one of the most common substance use disorders worldwide. It affects millions of people, but what makes it especially important in addiction psychology is how deeply it's connected to impact on mental health, trauma, and then social factors as well. So it's not just about alcohol in itself, but it's also about how addiction impacts lives, families, and the entire communities and leads to bigger issues such as financial problems. And the importance of what's the importance of accurate diagnosis and effective treatment? Well, accurate diagnosis in AUD is extremely important because it ensures that individuals receive interventions that are truly addressing the severity and underlying causes of their condition. So when an assessment is precise, the treatment can be tailored to meet specific needs of the clients, leading to better outcomes. And then there's a lot of evidence-based approaches such as like cognitive behavioral therapy, motivational interviewing. They all play a key role in supporting recovery. These individual therapies not only help individuals change behaviors, but also strengthen motivation and coping strategies. And then further on, it also reduces the likelihood of relapse and then also promoting long-term stability. Now, the impact of AUD is not just on health, economic stability, but also on social well-being as well. Alcohol use disorder doesn't just affect a person's health, it has far-reaching consequences in society as well. From health perspective, AUD is linked to serious conditions like liver disease, health issues. So especially in my personal life, my dad, his drinking caused his kidneys to shut down. It caused him to have liver issues. And so now he was, for the longest time, he was on dialysis, waiting for a kidney transplant. So definitely lots of health issues related to chronic alcohol use. And then, of course, it has mental health disorders impact on that as well, adding on to depression and anxiety. And as far as looking at it from an economical perspective, it also takes a huge toll with costs tied to healthcare, loss to productivity, and even expenses within the criminal justice system. But one of the most profound impacts is on the social well-being. So AUD strains relationships, it can contribute to domestic violence and even child abuse, and can affect overall community safety. Understanding these effects helps highlight why effective treatment and diagnosis are so crucial. So now let's go ahead and talk about the diagnosis overview. So alcohol use disorder is diagnosed when someone's drinking starts to cause real problems in their lives. So whether that's affecting their health, that's affecting their relationships, or their responsibilities, and it obviously could be occupational as well. According to the DSM-5 TR, this happens when there's a pattern of alcohol use leading to significant impairment or distress over a 12-month period. There are 11 key symptoms that can be found in the DSM, and they fall into four major categories. So the first category is impaired control. So that's drinking more than intended or struggling to cut back. And you can definitely see that with some of our patients that come in and they're talking about, like, I've attempted to cut back, but nothing works, and they continue to use. The next one is social impairment. So like alcohol affecting school, work, relationships. So this would be impairments in many different areas. And the next one is risky use, meaning that drinking continues even when it's causing harm. So regardless of whether your job is in jeopardy, your health is in jeopardy, your relationship is in jeopardy, you continue to drink. And finally, physiological dependence, which include tolerance and which means needing more alcohol to feel the same effect, and then withdrawal as well. So experiencing symptoms when stopping or cutting back. So severity is determined by the number of symptoms present in the DSM. So this can be found in that section. Mild AUD would mean basically you have 2 to 3 symptoms, and then moderate would be 4 to 5, and severe is anything 6 or more. So understanding these criteria is essential because it helps us provide the right level of support and interventions for each person struggling with AUD. So now let's go ahead and talk about the prevalence and just the impact of AUD. AUD has a major global impact. It contributes to millions of deaths each year. So worldwide, about 2.6 million people die annually from alcohol-related causes. And then there's hundreds of millions that live with AUD. In the United States alone, nearly 29 million people that's age 12 and older meet the criteria for AUD, with men disproportionately affected. So research shows that men are more likely to struggle with AUD due to higher levels of alcohol consumptions and just more detrimental drinking patterns compared to females. This gender disparity is significant. Men not only drink more frequently, but they also are more prone to binge drinking and alcohol related complications. So beyond individual health, AUD has economic and social consequences like we talked about in the previous slides. And the financial burden includes healthcare costs, loss of productivity, criminal justice expenses, and then socially AUD strains relationships. It increases the risks of domestic violence and impacts the overall community safety. And these statistics once again underscore the need for effective prevention, diagnosis, and treatment strategies that account for both demographic trends and individual risk factors as well. And luckily, there are a lot of psychological assessment tools that are evidence-based and supported by research for their effectiveness. And there are several of them that can help identify and diagnose alcohol use disorder. So each serves a unique purpose, whether it's a quick screening or more of a comprehensive clinical evaluation. And one of the most commonly and widely used tools is called the Alcohol Use Disorder Identification Test, which abbreviation is AUDIT. And it's developed by the World Health Organization. It's a 10-question screening tool, and it's designed to identify risky drinking patterns. There's also a shorter version as well. It's called the AUDIT C, which focuses on 3 key questions, especially useful for primary care settings when there's a limited amount of time, but it's a quick assessment to be used when it's needed. And another simple tool is CAGE questionnaire, which consists of 4 questions that screens for alcohol-related problems. And it's as simple as just answering yes or no questions. And if someone does answer yes to 2 or more questions, it does suggest a potential issue, prompting further evaluation. So while it's not a diagnostic tool on its own, it is a great starting point for like deeper discussions about alcohol use and even more of a comprehensive assessment. For a more structured and in-depth diagnosis, clinicians use the structured clinical interview for the DSM-5. So the abbreviation for this would be SCID-5. This tool is pretty amazing because it systematically evaluates symptoms based on the DSM-5 criteria, making it a gold standard for diagnosing AUD. And the updated version further is refined, ensuring accuracy in clinical assessments. And then one of my favorites, which is a biopsychosocial assessment, which is a more holistic approach. This evaluation considers several different components, the biological factors, psychological, and then also social factors as well. And it's to fully understand how addiction impacts a person's life. So they help tailor interventions to individual needs rather than relying solely on standardized screening tools. So my choice would be kind of combining both of these. So using a standardized tool, but then also using these clinical assessments as well in combination. And each of these diagnoses do play a crucial role in diagnosing AUD and guiding treatment decisions. The key is selecting the right tool based on the setting and then obviously the level of details required for an accurate diagnosis. When you're selecting a tool, an assessment tool, it's also important to consider possible factors that may be affecting and impacting the assessment tool as well. And so choosing the right assessment tool for AUD isn't just about picking something that's standard, it's about finding the most effective approach for each individual. So several key factors influence this decision. First, there's reliability and accuracy. So assessment tools need to provide consistent results to ensure we're getting clear pictures of someone's alcohol use patterns. But beyond that, we also have to consider cultural factors as well. So things like norms, values, and beliefs can shape how someone perceives their drinking habits and how they respond to assessment questions. Another big factor is client honesty and willingness to self-disclose. So if someone feels judged or they're uncomfortable, they may not answer truthfully, which can affect the accuracy of the assessment. And I think this is one of the discussions that we had done on older adults, and this is a huge one for them as well. They feel like they may be judged, so a lot of underreporting of symptoms where they do exist, but they just feel too ashamed to talk about it. And then there's stigma and fear of judgment, which plays a role here too. So creating a safe and supportive environment is really the key to completing a successful and accurate diagnosis or even assessment. It's important also to consider co-occurring conditions. So many individuals with AUD can have underlying mental health or physical challenges that can impact how their alcohol use presents. So that's why it's really important to complete a more of a comprehensive assessment to view the person's situation. Finally, we do have the client-specific needs as well. Not every person fits neatly into a standard screening tool. So assessments should be tailored to their circumstances, ensuring that factors like motivation, satisfaction, and personal goals are taken into consideration. The goal isn't just to diagnose, it's to guide meaningful interventions and to that truly support the recovery of these patients. There's been a lot of discussion about cultural humility over the past several years. And so, what is it exactly? So, cultural humility is an essential mindset in therapy and mental health care. It's not just about knowing different cultural identities, it's an ongoing process of self reflection. It's about learning, it's about respecting others' values and worldviews. The key is approaching interaction with openness and empathy rather than assuming expertise or superiority. So, even though I may be raised in a East Indian culture, and if I'm working with someone, I may automatically assume that their situation is similar to mine, but it may not be. So cultural humility means being able to really be open and willingness to learn from that individual. Mental health professionals are constantly working to provide competent care to diverse populations, but connecting effectively with clients from different backgrounds, it can be challenging. So this is where cultural humility comes in. It helps building strong therapeutic relationships and it also leads to better outcomes. A useful framework for applying cultural humility in therapy involves 4 different steps. So, number one would be engaging in self examination and self awareness. So, that just means reflecting on personal biases and assumptions. The next one would be building the therapeutic alliance. So, that would mean creating a space where clients feel heard and valued. And then the next one would be repairing cultural ruptures. So, acknowledging and addressing moments where misunderstandings may arise. So, not just like pushing them to a side when you acknowledge it, you recognize it, you address it in your sessions. And then it's navigating value differences. So respecting different perspectives without imposing one's own beliefs. And then ultimately, cultural humility is really about continuous growth, ensuring that mental health professionals meet clients where they are in a way that's respectful, it's inclusive, and impactful as well. And why is this important in AUD treatment or in counseling services in general? Well, cultural humility plays a crucial role in addiction diagnosis because it helps create a stronger, more trusting connection between clinicians and clients. So when clients feel respected and understood, they're more likely to engage in assessment process and they're more likely to be open and honest, and also reduces biases and stereotypes that could interfere with the diagnostic accuracy. So addiction doesn't always look the same for everyone, and cultural backgrounds can shape how individuals' perspectives and substance use recovery and treatment. So by approaching each client with humility, it just allows for openness. Clinicians can provide more precise and meaningful assessments. Another key reason for cultural humility does matter is that it ensures assessments are tailored to each client's unique cultural context. So it's a one size fits all approach. Doesn't work with clients in addiction diagnosis, and it resonates with one person may not be relevant for another. So taking cultural factors into account, it does improve engagement. How does awareness help though? Well, cultural awareness plays a crucial role in shaping how clinicians approach addiction assessment and treatments. So, understanding these cultural factors, they help ensure that the right assessment tools are used and that results are interpreted accurately. So, without this awareness, there's a risk of misdiagnosing or even overlooking critical aspects of the client's experience. And then another thing is it also guides the development of culturally adapted interventions. So, meaning treatment. Strategies that align with the client's values, their beliefs, their lived experiences are more likely to be effective. So, when interventions feel relevant and meaningful, clients are more likely to also engage with them, leading to better outcomes in treatment. And then like beyond individual treatment, cultural awareness also breaks down barriers that might prevent someone from seeking or even fully benefiting from care. So factors like stigma or accessibility challenges can be major obstacles, but an inclusive, culturally informed approach, it does help to ensure that cultures feel safe, supported, understood throughout the entire treatment process. So culture does play a pretty large role in how alcohol use disorder is understood, diagnosed, and even treated. So in some societies, drinking is deeply embedded in social traditions. So it's a part of celebrations, gatherings, and even professional networks. In others, it's strictly regulated and frowned upon. So these cultural norms can shape drinking behaviors, sometimes even prompting binge drinking due to peer pressure or societal acceptance. And then there's, of course, religious beliefs that can also influence attitudes towards alcohol. So some religions forbid alcohol use altogether, while others incorporate it into religions and rituals. These beliefs created boundaries around alcohol use, shaping how individuals view drinking and addiction. So in certain cultures, addiction is highly stigmatized and seen as a moral failing rather than a medical condition. So stigma is another major factor in societies where alcohol use is viewed negatively. People may hide their drinking habits or avoid seeking help altogether. So fear of judgment can lead to an underreporting and making it harder for clinicians to get accurate assessments. When addiction is framed as a weakness rather than a treatable disorder, individuals may obviously delay treatment, leading to poorer outcomes. And so recognizing these cultural influences does allow for more effective, personalized approaches to diagnosis and treatments. So instead of using, again, a one size fits all model assessment, it should be tailored to each person's background and then also their lived experience. So, in order to diagnose AUD effectively, it does require a comprehensive approach, like we talked about. So, one that looks just beyond symptoms and it considers a person as a whole person. So, like a thorough assessment helps ensure a holistic understanding of the client's condition, leading to more accurate diagnosis and interventions that really truly do fit their personal needs. So, a well rounded assessment should explore multiple areas. So, this includes their drinking patterns, this includes withdrawal symptoms, alcohol related challenges like legal and occupational issues, or even personal issues like self efficacy and readiness to change. So, it's important to evaluate co occurring mental health and physical conditions, neurocognitive functions, and overall social well being. So, standardized tools help with this, but again, structured interviews ensures that assessment process is both precise and also personalized as well. Another key kind of a piece to this approach is interdisciplinary collaboration. So I know sometimes it's a little bit more difficult, but alcohol addiction, because it's so complex and addressing it effectively does require input from multiple professionals. So that could include medical doctors, psychologists, social workers, and then community support teams. And by working together, these professionals can tackle the biological, the psychological, and social aspects of AUD. So again, leading to more effective and sustainable treatment outcomes. Again, not always possible, but it is something that is highly recommended and supported by research. So there are a lot of evidence-based practices that have shown to be effectively like treat alcohol use disorder. And the key is to match the right approach to each client's specific needs. So one of the most commonly and widely used therapies is cognitive behavioral therapy, which does focus on identifying and challenging thought patterns that contribute to alcohol use. It helps clients recognize triggers, develop coping strategies, and it also reduces relapse risks over time. And then there's another highly effective approach as well. It's called a motivational interview. And that is also a very client-centered technique that helps individuals build internal motivation for change. So this method works particularly well for people who feel unsure about quitting or cutting back. And so it does encourage a lot of self-reflection without feeling pressure. Psychoeducation is another huge and very important tool. Many clients benefit from understanding how alcohol affects the brain, the body, as well as the science behind the addiction and recovery. So when people have the knowledge about their condition, they are more likely to engage in treatment and make informed decisions. So beyond therapy, there are other evidence-based interventions as well. So brief intervention is one, which are structured conversations, basically designed to prompt like behavioral changes. There's also medication availability, which can help reduce cravings and support recovery when it's combined with therapy. And then there's relapse prevention strategies, which are also very crucial in treatment, which focus on teaching skills like maintaining sobriety long term. And the effectiveness of all of these approaches does depend on accurate assessment. So choosing the right intervention based on where the client is in their recovery journey. So someone might be in denial, might benefit from motivational interviewing, while someone that is struggling with negative thought patterns might benefit from CBT. So assessment really does help identify also co-occurring mental health conditions as well, which may definitely need to be integrated into treatment. It's equally important to adapt treatment to each client's cultural background, like we talked about. So culturally sensitive psychoeducation, for example, can make interventions more relatable and more meaningful, helping clients stay engaged in the recovery process. When we're working with any diagnosis, it's always important to consider any ethical considerations. So there's also some in AUD as well. So some of the ethical considerations are the core and of course responsibility of all counselors. And one of the most important obligation is informed consent. So that means making sure that clients fully understand the purpose, the process, and potential outcomes of their assessment and treatments. So this includes also explaining the limits of confidentiality, especially in situations where disclosure might legally be required. So such as when there's a risk of harm to self or others. I've had situations where even drinking and driving was one of the conversations that I had to have with my client very carefully to make sure that they understood my reporting duties, if they put anybody else's life in danger or whatnot. Informed consent isn't just a formality, it builds trust and empowers clients to make informed decisions about their own care. And so another critical aspect of confidentiality is protecting the client's information is fundamental to ethical practices. So the clinicians have to adhere to legal guidelines like the HIPAA in the US to safeguard all of their sensitive information. And a breach of confidentiality can definitely seriously damage the therapeutic relationship, making it harder for clients to feel safe and open up about their struggles. So by prioritizing ethical obligations like informed consent and confidentiality, clinicians can foster trust, ensure responsible care, and creating a supportive environment for those clients seeking help with alcohol use disorder. It's also important to consider practical challenges. So addressing addiction effectively does require culturally adapted tools. So adequate resources and collaboration among professionals. But in practice, there are several challenges that can make it difficult. So one major hurdle is access to culturally adapted assessment tools. So many standardized screening tools don't fully account for cultural nuances, which can lead to inaccurate or biased results. To ensure fair and precise evaluations, clinicians do need to seek out or even modify tools that are validated for diverse populations. Another challenge is resource limitations. So many professionals don't always have access to culturally competent trainings or materials, which can make it harder to provide effective care. So one way to kind of bridge this gap is through interdisciplinary collaboration. So working with cultural consultants, social workers, and other specialists who can bring different perspectives to addiction assessment and treatment is a great option. Beyond individual training, a more collaborative approach can also make a big difference. So exposure to different cultural backgrounds, engaging with diverse communities, integrating varied perspectives into practice can all help ensure like it's inclusive and you're providing equitable care. When assessment interventions truly reflect a person's lived experience, they become so much more effective in supporting long-term recovery. So, in conclusion, alcohol use disorder is a serious diagnosis that impacts nearly every aspect of a person's life. It could be from their relationships to their work and overall well being. So, it's not just about alcohol consumption, it's about how addiction disrupts daily functioning and creates long term challenges. That's why, when working with AUD, evidence based assessments and intervention strategies are so important. Using the right tools can help ensure accurate diagnosis, comprehensive case conceptualization, and then appropriate treatment plans that actually work. So when interventions are tailored to the person's specific needs, recovery becomes much more effective and sustainable as well. Just as important as the integration of cultural humility and awareness, recognizing the role of cultural influences, ensuring assessments are fair, inclusive, and meaningful. So a personalized, culturally responsive approach doesn't just enhance engagement, but it also improves long-term outcomes, and that's what we're really aiming for. And by combining strong clinical assessments, effective evidence-based treatments, and culturally informed perspective, a clinician can better support individuals with AUD and help them with their path to recovery. So thank you so much for your time and being able to listen to my presentation. And then I did include references in the following slides. So go ahead and take a look. So thank you so much and have a good day.